This is Daniel. Daniel was a patient for like a year and a half before we started him up on ModMouth. And it was the hygienist, really. It goes back to one of the original slides. He had gingivitis and recession occurring on the lower anteriors. And we tried putting on a more frequent recall. I probably mentioned, teeth straightening, but it went right over his head. But he started to form a relationship with my hygienist in the office appropriately, totally. But he wanted to do better for the hygienist. And he said that he's still finding bleeding and it's still there. She said, have you noticed by the crowded areas that you're having the hardest time keeping clean, that it's bleeding? He said, yes. She said, you should really talk to Dr. D and talk about straightening your teeth. And he said, yeah, I think he mentioned it in the past, but now he really wanted to please the hygienist because he wants to do better. He wants to have good oral hygiene and to come to a visit and be told everything looks good. So he had moderate upper and lower crowding, constricted arches. You're going to appreciate that when we look at the intraoral photos. He also had an anterior crossbite as well as a unilateral, just one tooth posterior crossbite. So let's take a look. We always take our photos. Take your photos. It's so worth it because then you have them. Once you have the photo, you can just submit it for a clear aligner case. If not, you have to have the patient come back. So you already have them. They don't have to come back. When they come back, they're starting treatment. So these are the photos we took on that same day. And you can look at the upper arch. I mean, it's a V shape. That's a true V-shaped arch. You can see the second bicuspid on the upper is, that's a rotated tooth to the point where I, as a general dentist, would not want to rotate that back. Why deal with a space posterior to it and have to deal with other problems? Right now, it has good contacts. But anyways, that's the V-shaped arch lower. You could see the crowding, and then you can see the crossbite that's occurring between the canine and the lateral. And if we go to the next slide. Look at him. 7 months later. This one, we did need one refinement. Again, one refinement is included with ModMouth aligners because in a case like this, anticipate that you're probably going to need a refinement because everything looks great, but the crossbite's still a little tight. You still need a little bit of movement or whatever it may be. But again, Chris, if you could just toggle back to where he started from. Sorry, there. I mean, he didn't want to smile. He looks like he's in his mid-30s. He looks like he was like just getting through puberty, right? He like kind of timid. When I finished this case, he was standing there. If you go to that photo, he was standing there and he looked like he was ready to take on the world. Yes, it's profitable, extraordinarily profitable to introduce clear aligners in your practice. 3/4 of your hygiene patients alone could benefit from it. But the appreciation I get in just 7 months or 4 months, when somebody's life is changed and it's such a simple treatment on my end, is so rewarding. Anyways, let's go to the next slide. The next slide is going to be me introducing. Oh, that's it. Okay, sorry. So this is a U-shaped arch. No longer is it a V-shaped arch. The crossbite is gone. Let me point out one thing before I bring on John. Look at the retracted view, of the lower anteriors, and look at the gingival levels there. And if you go back, Chris, to the previous intraoral photos, and this is what the hygienist was pointing out. Look at the edema, the redness, right? And look at 24. 24 started a recessive pattern. The gingiva was so thin, he was going to end up with a nice amount of recession on that tooth. And if you look at the end, when he has a nice round arch and everything's put into place, and this is taken right after treatment, so this is not like years later, the gingival margins straight across are even. We literally, and was there grafting? No. Was there any medicaments placed in there? No. We gave him the ability that a toothbrush and floss could actually access these areas, and the mouth responded and the body responded. It's remarkable.